Oakville Trafalgar Memorial Hospital opened their field hospital in the top floor of the North Building in December. Unlike the pandemic response unit at Joseph Brant, it is not being used for COVID patients.
The field hospital has partitions, so each space is partitioned off. It has a privacy curtain. It's equipped properly for a patient, but we don't really have the ability to isolate patients safely in this space. So COVID patients need to be in an isolation, isolated on what's called droplet precautions, and so we have to keep them in a separate room, and we don't have the ability to do that in this space. This is essentially just an empty shelled-in space that eventually will be built out to the same specifications as the rest of the hospital. But the advantage of this as a field hospital is that it's inside, so we're not in a tent, and it's warmer, and it's not sort of exposed to the elements that perhaps a tent might be.
As of yesterday, the field hospital has the staffing capacity for 40 more patients.
So what that does for us is it allows us to put patients here who are not COVID positive or under suspicion for COVID, and then it frees up space in the rest of the hospital for sicker patients, and then also for the transfers that we have been accepting from other hospitals as well, because those are all COVID positive patients that are being transferred here. So it's really a relief to the system to be able to have the additional 40 beds. And we have the 40 beds here, and we also have 12 beds at our Milton District Hospital as well that were opened much earlier. So we've been using those beds since June, actually.
In order to provide adequate care for the additional patients, Halton Healthcare had a hiring campaign.
Both registered nurses, registered practical nurses, we have obviously environmental services staff and others. And so it's a bit of a mix of bringing in new staff, and then we also moved some experienced medical surgical nurses from the hospital over here so that they could support the newer staff. And they really understand this patient population very well and can help us to get those patients looked after safely and get them discharged. Because we're really looking at trying to have people in the field hospital who have a shorter length of stay, because it's not ideal space. So that's what we've done. We also have incredible, what we call pandemic support assistants, and they are primarily students that we have hired. We've hired a lot of them since the beginning of the COVID pandemic, and they are providing support. They can get things for patients. They can keep an eye on people. They're not registered staff, obviously, but they can do a lot of different tasks. And one of the big things they've been doing is our virtual visiting program, which is bringing an iPad to a patient, and they schedule a face-to-face visit with family members if the family member is not able to come in and visit. So they've been really invaluable in our response as well. And physicians, obviously, we have physicians from the what are called hospitalists, who are the physicians who are responsible for the patients in the field hospital as well.
Reporting for Halton News, I'm Nikki Wesley.